Hello everybody, this is Dr. Connors and I'm going to talk in this section about what other tests could I or should I do. So this is for our patients, commonly asked questions, trying to cover this to help you walk through this decision-making process. There's a lot of tests out there that you could do or should do. First of all, we're going to cover the tests typically that your oncologist is going to recommend. So typically your oncologist is going to recommend CT scans, PET scans, MRIs, maybe bone scans, biopsies, more invasive type things. We're not going to cover that in this section here, but I will say when I say these are invasive tests, I don't mean that you should avoid them at all costs. Many times they're important to do, especially if you're following a protocol from your oncologist, meaning you're doing some sort of standards of care via like radiation or chemotherapy or surgery or something. You're going to need to follow their recommendations. Now, I call them invasive tests because there is some invasiveness to them. You do a CT scan; those are sectional tests, like you're going to do an upper body CT or an abdominal CT. Each one of those sectional CTs carries about the rad dose of radiation of about 50 chest x-rays. So they're not something that you should just, do to satisfy your curiosity. It's something that you do to change your decision-making process and how you're going to treat the patient. And there's times that you have to do that. We need to see if this cancer has grown. This person has, some signs and symptoms of worsening, and we're going to change our protocol, maybe change the chemotherapy. Should it be true that the cancer is growing, we need to do another CT scan to compare with the last CT scan that we did X amount of months ago. Well, the only way to compare that is to compare apples to apples, and that is to do another of the same tests that you did prior that brought you to that decision-making process that you're following through with right now. So there's times that a CT scan, PET scan, MRI is very appropriate. You just have to know that there are risks to it. Typically, MRIs are going to be done with a contrast dye, and typically that's gadolinium, and that does build up in your system, and some people have a very difficult time detoxifying, and it can have reactions to it. So MRIs are not without their risk either, even though there's no radiation. So there's a time and place for invasive tests. That's a discussion that we can have individually. That's something that definitely you need to do if you're following standards of care. But just to do them to satisfy curiosity, if it's not going to change the way you treat the patient, I don't know if that's the right decision-making process. But what we want to concentrate in this video is what are the less invasive tests that I could do that could help me move my care in a different way, that gives me some more data to, change maybe my nutritional protocol a little bit or tweak something in my protocol. These, I would say, are less invasive tests: an ultrasound, thermography, labs. Of course, a lab is invasive because they stick you with a needle to draw blood, but it's certainly not, typically harmful. There's not going to be any lasting issues with that. So let's talk about some of these tests that we more often recommend. So the first is an ultrasound. Now, an ultrasound would only be appropriate depending upon the type of cancer that you have. So if you have prostate cancer, they're not going to do an ultrasound to see if your prostate cancer has grown. But if you have breast cancer and you haven't had a lumpectomy or a mastectomy and you're looking for a change in size, that may be an appropriate test. Now, your oncologist may argue that, you get a much better idea of where it's at if we do another MRI, but we've had patients that opted out of MRIs because of the contrast dye, and they wanted to just follow their cancer with an ultrasound. Well, that seems reasonable. So an ultrasound can be a reasonable test for things like that. Ultrasound can be a reasonable test for bile duct issues and gallbladder issues and some abdominal type cancers. An ultrasound can be a reasonable test to see and guide further care. Thermography can be another reasonable test, especially with breast cancer or head and neck issues, head and neck cancers. Abdominal cancers, no, not really. Prostate cancer, no. But breast cancer, you could use thermography as a guide to, is the cancer, am I improving or not improving? The problem is that sometimes when you're killing the cancer effectively, either using chemotherapy or using the Rife and nutrition, the cancer can look hotter on thermography because you are stimulating an immune response to the cancer. That's what we're really trying to do, is get your immune system to kill the cancer. And the thermography can actually look worse. So you have to know that with any test. That can happen with a CT scan or MRI as well. And the same thing with an ultrasound. If you're effectively killing the cancer and your immune system is populating a reaction to the tumor can look larger for a period of time because you're causing this state of local inflammation as your immune system is attacking it. So you can get what's called a pseudo enlargement of a tumor, or a pseudo worsening of a cancer, because your body's actually doing what it's supposed to be doing, what we want it to do. So you just have to understand that with any testing. The next is laboratory testing. So laboratory testing is something we really like to see. And it's some lab tests your oncologist will recommend. So that's what we're going to spend more of our time on this video. And this is where the slide gets a little bit more comprehensive. So laboratory testing could be broken down into 3 categories. Some of your standard tests, and then we could call them some specific lab tests that are specific to cancer, and then some functional labs. So the standard labs that your oncologist or your general practitioner may already be doing are things like a CBC, that's a complete blood count, or a complete metabolic panel, which is going to measure your alkaline phos and your liver function tests. And understand different labs have different names for these. There's no standardization necessarily for names of labs, except for some of the general ones like CBC and a complete metabolic panel. And then there's a comprehensive lipid panel where we get into the breakdown, and different labs have different tests for that, where you get into not just your LDLs and HDLs, but you get into oxidized LDLs and HDLs and things, and that gives you a much better idea of how the fats in your body are doing. Now, typically, we're not interested in that so much with cancer. So comprehensive lipid panel wouldn't be really anything you'd really necessarily do with cancer, except that just because you have cancer doesn't mean you don't have other things going on. You have the right to have more than one problem at one time that you may want to address. So that may be something, and it is something that we have ordered or told people to order in the past, just like your thyroid panel. Well, if you have liver cancer or colon cancer, what do you care about your thyroid panel? Well, to be honest, you should care about it, because if you do have hypothyroid or Hashimoto's or something like that, that could really affect your ability to elicit an immune response. If your thyroid is low and your energy is going to be low, you're going to have fatigue issues. That's just, quality of life issues. It's not good to be walking around with low thyroid, worse to be walking around with high thyroid. So it's something that you may want to address. And it's something, just because, again, you have cancer doesn't mean we can't look at other things too. Other specific labs to cancer would be mainly just the tumor marker tests. And we'll get into detail with that. And tumor marker tests have a place, and you have to understand that place. So we'll talk about that in just a second. And then functional tests. So, well, before we were really a specific cancer clinic, for years we did a lot of functional tests, different nutrient tests, different what's called a OAT test, which is an organic acid test, mold tests, parasite stool tests. I mean, there's literally dozens and dozens and dozens of different functional tests that you can test for. And you can spend a lot of money on different tests, and they can give us different data. Specific to the cancer, not really specific to the cancer, but certainly if you have mold issues or parasite issues and different things, it's going to hinder your body's immune response to be able to kill the cancer. But many times, the reason why we don't do a lot of functional tests with our cancer patient is that many times our cancer patients are taking care of themselves because of the cancer better than we could ever have gotten our sick patients, our autoimmune patients, years past, even doing an oat test and a mold test of parasite, getting them motivated to follow their diet and such. That still wasn't enough. So most of our cancer patients are following a strict regimen and good nutrition and specific nutrients that will be addressing a lot of those things anyhow. So if a person came to us and said, I just got diagnosed with cancer and I want to do all these labs, well, certainly we can. It does get expensive to do all those labs, but it certainly can be done. We can do food sensitivity testing. We can do different Cyrex antibody tests, and there's a whole bunch of stuff that I love to do, and they're fun to look at. It takes a lot of time, though. So you have to realize that if we do our cheek swab test and we're doing our diet and we're doing specific nutrition to the cancer, many times a lot of those results of those tests, if you had ill results on those tests day one of your treatment, they would have resolved themselves at 12 weeks in or 6 months in. So we don't really see that there's a particular necessity to do any of those tests. If a person comes to us and they're doing really well and they're in a relative state of remission, but they want to start addressing some other things that they have going on in their body, well, certainly we can run some of those panels. We have the ability to run any possible functional medicine test that you can imagine. So just contact us and we can run those tests. So we charge on the test, we just charge the cost of the lab, and then you pay for our time to go over it with you. So just so you know. And then the hormone test, the Dutch hormone test, it's called a Dutch dried urine hormone test. That's the best type of hormone test out there. That's the most common functional test that we run on cancer patients, and they're typically female cancer patients that we run that test on. And let's talk about those. So these are the most common tests that we ask people to run. So now, why do we ask people to run them? Because if you have insurance, and I know the days are changing and people have, $10,000 deductible insurance policies. But if you've already met that deductible and you have a physician, a local physician that will run these labs and they will get covered under your insurance, well, by all means, we want the best for you. So if you can ask your physician to run those, then that would be best. But I'll tell you a little secret. We work with a company called Wellevate, and we run our labs through that, and they run through LabCorp. So, for instance, a tumor marker panel, a pretty complete tumor marker panel that we would recommend for females, which is more tumor markers than we recommend for males, I think is $74 or something like that, plus a $7 draw fee if you go to a LabCorp lab, which Wellevate will help set up for you, and you'll be able to locate the closest LabCorp draw site. So we can order any of these tests for you. We cannot order and will not order a CT, PET scan, and MRI, nor will we order an ultrasound. But we can help you find somebody to do a thermography with. We can help you order any of the laboratory testing. So we can order that, and lots of times it's a lot less expensive. So you will pay for our time to go over it, and that's only if you want to go over it. Quite honestly, a lot of our patients, at least, that have been in this process have looked at their CBCs for the last several years, and they can look at their CBCs and make sure their hemoglobin is still in a healthy range or not, and they don't need to go over it with us, but we'll be happy to do that. Now, some specific details on the tumor markers. Here's the typical tumor marker. This is our tumor marker panel that we like to see for females: a CA15-3, CA19-9, CA27-29, CA21-25, CEA, and an LDH. Now, if you are like, what did he just say? There is a blog post on our site. If you just search in that little search thing, tumor markers, you'll see a blog post on tumor markers that go into detail explaining these. So The CA15-3 is really specific to breast cancer, so is the CA27-29, but the CA19-9 can be more specific to pancreatic cancer. It can show up on breast cancer as well. CA125 and the CEA can be for ovarian cancers. They can be for abdominal cancers. LDH can be for any cancer, and PSA is specific to prostate. So that would be only for males. But these would be the panels that we would run, and they range from about $50 to $75 plus your draw fee. So it's fairly inexpensive. We can order those for you. So contact your liaison, contact the clinic, and we can order that panel for you if you're a full cancer patient with us. We can order the CBC and the complete metabolic panel. We like to order one that has a whole bunch more than that too. And the cost of that, I think, gosh, we could do, there's one for $75 and then there's a full one for $145 or something like that. So it's fairly inexpensive for those panels. So just let us know. We can order those for you. I did want to share on the Dutch hormone test. That is one that typically we would do only for women usually. And it would be for if you have female cancer. So a female with colon cancer, really we don't need to do a Dutch test. A female with breast cancer or ovarian cancer, we still don't need to do a Dutch test, but it is something that we can do. Why wouldn't we want to do a Dutch test? Because in most cases, if you've been on a nutritional protocol, what we're really looking for in the Dutch test, what it does is it breaks down all the metabolites of your hormones. So the different metabolites of progesterone, testosterone, and sometimes most important, the metabolites of estrogen. Yes, you have about 33 different metabolites of estrogen circulating in your body all the time. It is really a couple of them that we would call the quote-unquote bad estrogens. And those are the ones that we want to look for. Some of these hydroxylated estrogens, now normally they're in your body, they're metabolites, meaning that it breaks down to that and then should break down to something else and get out of your body. But it's when that bad estrogen builds up in your body that it can be a problem. To be honest with you, all the years doing Dutch tests, we typically don't do them until after we start a treatment process. And I have never seen the bad estrogens out of balance. I shouldn't say that. A couple times, but hardly ever do you see it because we have the woman on things like DIM and Estro Clear and different nutrition to help support detox pathways and such that are really helping clear those out, and gut binders that are helping you to not reabsorb those. So we are already dealing with that, and it's rare that the Dutch test, when we do it, really changes our course of action. So it's fun information, and it is really cool to look at, but it really doesn't change our course of action. So I don't recommend it that often. The tumor markers, I did want to touch on that again, because one other thing about the tumor markers that you have to know is that tumor markers can be sometimes not a good sign. So if you're doing chemotherapy, there isn't an oncologist in the country that's going to suggest tumor markers, because typically if you're doing chemotherapy, you're causing cell lysis. That's a different type of cell death. The cell is dying pathologically due to the chemotherapy, and it's going to spill this protein. Tumor markers are proteins, are enzymes that are produced by a growing cancer. Not all cancers will spill out tumor markers. So you could have a stage 4 cancer that's growing aggressively and all your tumor markers are within normal limits, just so you know. Then they don't really become valuable to test at all, but you don't know that until you do a test. But if you do have tumor marker that's out of balance, you can possibly, I say that, possibly use it as an indicator of how your cancer is doing. If your tumor marker is going up and up and up and up, that's an indication that your cancer could be growing. But the truth is, it's also an indication that your cancer could be rapidly dying in the case of using chemotherapy. Could it be rapidly dying in the case of using natural things? Well, maybe too. But any test, whether it's a PET scan, a CT scan, an MRI, ultrasound, anything, or a tumor marker test, you don't use one test to say, oh, this person's doing worse, or oh, this person's doing better. You have to guard that test and balance it with other signs and symptoms, other objective and subjective findings. If I'm feeling fantastic, but my PSA is going through the roof with my prostate cancer, that could be, well, do I have growth in my prostate cancer? Well, it could be. I don't have any other signs and symptoms, so I have to weigh it out. Maybe I need to do another test. So all tests, regardless of what the tests are just indicators. They're just little signs. They're just little flags. They're little hints of something could be going on. Maybe it tells us we need to dig a little bit more. Maybe that's when we get into more invasive tests. That's why you do a test. It's not a diagnostic sign in itself, but it gives you signals to balance out through differential diagnosis what is the right thing and the right way to go and how this person is going. So remember that when we do any of these tests, because I don't want to, be having discussions and talking you off the cliff when your CA 2729 jumps up 10 points, but the rest of them are balanced, but you feel great. So it could really mean nothing. It was just that specific time of day that they drew the blood that marker was higher. So you have to remember that. That's why it's good to do tests on a regular basis, to run these on a regular basis. And that's why I'm glad that they're not all that horribly expensive, so they are affordable to do. If you do tests with us, we will get those results back. If you do them through our program, through Wellevate, we'll get those test results back in our folder, and we will inform you when we get those results back. If you do the test through your general practitioner or through your oncologist or through your naturopath locally, well, then you have to tell us that you got those tests back, and you email them to labs@connersclinic.com. You email them to labs@connersclinic.com, preferably a PDF of that lab. So let us know. You'll get a standard email back that says, if you want to go over these, it's up to you to tell us. So when we get labs, they go in your portal. Everybody has a EHR, electronic health record, in our office, and that goes into your health record so that we can view it. But we are not going to view it and go over and then make a decision to call you. You are going to have to make a decision if you want us to have a discussion. So just like any other office visit, you will have to pay for that office visit for us to discuss your labs. So just understand that. So if the cost of your lab, if you have it done in a naturopathic's office or your oncologist's office, and they're upcharging you the cost of the lab because that's including a discussion about the lab, well, then you should have that discussion with them about the lab. So just so you know. So if you need to talk, you have a concern, you just need to understand what the lab means. You need a retest, you need to think about doing a cheek swab again, whatever, you need to contact us. So we're always a phone call away, so just let us know and know that we're here to talk. We're here to bounce ideas. If your lab's got way worse, don't freak out. We're here to talk to you and retest you and tweak things. That's our promise. We can't promise that we're going to get you better, or that you're not going to have cancer anymore, or that you're going to be healthy and you're going to live to 172. But we can promise that we'll do everything we can to move you in the right direction for your goals. That's all we can do. Everything else is in God's hands, and He's sovereign over everything. So, and we will be praying for you. So if you just need somebody to talk to and to pray with, you call us and let us know, because we want what's best for you. So hopefully that explains what you should do. Should I do other tests? Could I do other tests? If you want more details, make an appointment with your liaison or myself or Michelle, and we can help you walk through that as well. Thanks.